Hi, my name is Leo and I'm an immunologist at the University of California, San Francisco. Coronavirus COVID-19 may be here to stay, so I decided to make this video. This coronavirus is a new type of virus in humans that originated in China from the consumption of bats as food. This virus is no joke. It kills between 1 to 3% of people that it infects. These numbers are even higher in older people and or those with pre-existing medical conditions, such as diabetes, respiratory problems, or those who take immunosuppressive medication. This virus destroys the red blood cells' capacity to capture oxygen when we breathe. And autopsies in China show a thick layer of mucus in the lungs of patients. So many of the infected people end up having to be intubated in intensive care units because they can't breathe. The United States is now leading the world both in the number of confirmed COVID-19 cases with almost 100,000 and the number of deaths from COVID-19. And these numbers will continue to increase. Coronavirus spreads through the air. The rate of infection is between 2 and 4. And with this R0, it means that each person will infect 4 people, and then those 4 people each infect 4 people, and so on and so forth. At this rate, we could have a doubling in the number of cases every 6 days. So we'll soon have 1 million cases in the United States alone, if we don't do anything about it. This coronavirus infects people, and at the beginning is asymptomatic. There's no symptoms for 4 or 5 days. But the people are contagious during those 4 or 5 days. More than that, this virus is produced in very large numbers. So every small droplet of a sneeze or a cough has tens of thousands of particles of this virus. And more than that, and the reason why people keep insisting that you wash your hands very well and frequently is that this virus is very resilient and it actually survives on surfaces. It survives on metal surfaces for 1 day, on plastic surfaces for 2 or more days, and there's actually reports from infected cruise ships and residual waters that it can be found for weeks afterwards. So you can catch coronavirus not just from other people, but also from a doorknob or any other surface that might have this virus. So I wanted to make 3 main points. One is that coronavirus doesn't pick. It can infect anyone. Tom Hanks has coronavirus. The president of Harvard University has coronavirus. Justin Trudeau's wife has coronavirus. Boris Johnson has coronavirus. Prince Charles has coronavirus. Dr. John Murray was key in defining respiratory syndrome symptoms here at UCSF, died from coronavirus 2 days ago. There was a child in LA that died from coronavirus a few days ago. So it's not just older people that die from this virus. And while many obviously don't die from coronavirus, many do need intensive care. And so if we all get infected with coronavirus at once, there will be not enough hospitals, ICUs, ventilators, doctors, and nurses to accommodate everyone. And so this will affect not just those with coronavirus, but also those with any other condition, like any medical emergency you might have, any surgery you need, now you can't get it because the hospitals will be overwhelmed. There's even many clinical trials that have been blocked if they're not COVID-19 related because they're giving priority to the COVID-19 ones. So now these drugs will take even longer to be tested and approved for all the many other diseases that people have. So work from home whenever possible and avoid social contact whenever possible. Here in California, there is a mandatory quarantine and social distancing, which means keeping at least 6 feet between people until at least April 7th, exactly to try to stop this spread as much as possible. Number 2 is that this virus is not going anywhere. It is estimated that between a third and 75% of the world population will eventually get infected with coronavirus. And more than that, there might be a second peak of infection coming up. During 1918, the Spanish flu had more than one peak of infection, and actually the second peak was more deadly than the first one. So if we now see 1 to 3% death rate, you can see even higher rates in this second peak that might be coming this next winter. So eventually in the future, we will have immunity at the population level to coronavirus. Those that survive that caught it, they will be immune to it, we hope, such that their R0 will be zero. That is, they no longer contaminate anyone in a meaningful way. But again, we need to space it out. We cannot have this all happen at once. That will collapse the health system and many other things. And then number 3 is that there's no approved treatment right now for coronavirus. Yes, there are drugs that have some anecdotal evidence that they help. For example, chloroquine is an example. But there's no rigorous clinical trial that has been conducted with these drugs to show that they work every time and that they're safe to use. So we're waiting on that. And in the end, the best solution will be a vaccine. But a vaccine, once again, it will take 1 year, maybe 2 years to get there, if it works. HIV, we've known that virus for decades, and there's no vaccine for AIDS yet. So we just have to hope that the vaccine will be developed for the coronavirus. So really what we can do right now is to prevent spreading, to stay home, to avoid social contact, to buy us time, for hospitals not to collapse, and for research in immunology and in this new coronavirus to find solutions for this. Thank you.